This week we will learn about electronic health records. Electronic health records, or EHR, is one of the important topics in healthcare informatics. So these topics from the EHR lesson, we'll see the the definition and history of EHR. Then we will look at the limitations of the paper-based healthcare records, and then to identify the benefits of electronic healthcare records. And at the end, we will see key components of an electronic healthcare records. So I'm sure most of you already have heard the EHR, the word EHR. So what is EHR? What is electronic health records? Please stop or pause this video and write whatever comes to your mind about electronic health records. Okay, now let's see how we can define the electronic health records, and then you can compare the definition or whatever you have wrote about the electronic health records. We define the electronic health records as an electronic record of health related information on an individual that conforms to nationally recognized interoperability standards, and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. Let's dissect this definition to see what are the important components of this definition. The first part, if you see the part 1, is the health related information on an individual and electronic health related information. Second part is, okay, so now we have information about an individual and we have this information, and this information is not on paper, it's on computer, digitally recorded. But this information should conforms to nationally recognized interoperability standards. Now you can recall your previous lessons where we have learned about the interoperability, and then you also have submitted your work about different types of ontologies and standards available. So idea is that the information of a person which is shared electronically should be shared in a way which would be nationally recognized standard. It should be shared in the format in a structured way, in a standardized way that would be understandable, interoperable, at least nationally, but ideally internationally. Okay, now third part of the definition, and that what is the source of this electronic health record? Who created this electronic health record? Is it created by the clerk sitting on the front desk, or is created by the authorized consultant, clinician staff? Because the information, the source of information, who created this information, who collected this information, is very, very important. Okay, now let's see this definition as a whole. Read again. Electronic health records, and electronic health records of a health related information on an individual. Okay, now we got this, and which confirms the nationally recognized interoperability standard. Second part, first star, no, the second star. Now the third star is, or the main point is, this information created by or managed or consulted by the authorized clinician staff across more than one healthcare organization. If an electronic recorded information about a person fulfills these three characteristics, then we can say this information is stored as electronic health record. Okay. Now write on your piece of paper whatever you have got from this definition, and then you can compare it with whatever you already wrote about the electronic health records that you had in your mind, the concept of electronic health record. All right, let's move on. Now, EHR for safety and quality of a patient care is very, very important. One of the main purpose of using the EHR in a hospital setting is saving cost and also improving the quality of the patient care. What you have to do that, you will click on this link and watch this video, and during this video you will take your notes, because then after that video there will be an activity for you to work on. Okay, if I can play this video, the sound does not record on the system which I am using, so that's what I'm not playing. That you can play on your end, maybe watch once or twice, and take your notes, and then go to the next slide to answer these questions. Now whatever you have to do this, if you feel that you don't have yet answer to those questions, then go back to the previous slide and watch the video again, and we'll write the answer on a paper that you will have. The first question is, how do EHR help towards patient safety? This was explained with an example in the video. The second question is, what modern medical procedures need EHRs? You should write. Then patient information management, how the EHR helps in managing the patient information, and how this information management would lead to saving a cost and improving the patient quality, safety, and value. All right. So when you are done with this activity, then you can resume the video and move on to the next slide. Now, again, a question to you: why do we need EHRs? I think when you have watched this video, when we discuss about this definition, I'm sure you have some concept in your mind. So please write on the paper the reason, what the concept you have built so far. Why do we need EHR? Pause this again, pause this video, and write on the paper, and then we will discuss later on. You can compare your notes with whatever I will explain. All right, let's see. Several reasons, but here I have highlighted a few reasons, important reasons. Number one reason is paper records. You see that if we have the information written or managed on the paper records, so it could be less legible, right? Sometimes it's not very easier for, the docs are famous for the bad handwriting. Sometimes, the handwriting is not readable, more difficult to retrieve, store, and share unstructured data. Now consider you have a data of about 10,000 patients, right? You have to, and you have to find the patient where they have all the patient where they have the age between 24 to 32. Even if you have the staff of the 15 people, it may take like several hours for you to go there and retrieve that information from your storeroom. You see, it's not only inefficient, it's time consuming, and it's costly process, right? But if we have even this information stored not even a sophisticated system, just like you store this information on your Excel sheet. With a single click with Control F, you can find writing the last name of the person or any hint about that record. You can find that those people, and even can do the conditional filtering. With the you even don't need to go to the sophisticated EHR system, even with the basic tool that we use every day. So that's why we say the electronic records are less likely to be missing and available 24/7 from multiple locations, comparing with the paper-based record where don't permit clinical decisions. Okay, we will discuss about this part. Now look at this 24/7. You see that, for example, now if you have to make a copy of 10K patient of records, I mean, how many papers you have to use, how many hours it will take, how many labor you need there. No, copying the 10,000 patient record, maybe that you can save in one single Excel sheet. It's just a matter of milliseconds or second. And you can have as many as copies to store that in case you lose that information. But in case that if your storeroom catches fire or any disaster happens to your facility where you are keeping those files, you will not have your if you don't have your backend, you will lose everything, right? And when you will go towards like predictions and electronic based clinical decision support system, that would not be possible where you have built a bar graphs charts, kind of that's you cannot do that with if you have stored information on papers. Now, the second important point is need for improved efficiency and productivity. I think we pretty much covered this point in the first as well. Let's look at it again. For example, if clinicians are more productive, charts are available and retrieval of result is faster. If you have to compare the recovery rate of 10 people, right? So if it will be drawn some way like in a chart or graph way, it would be very easier to keep record and also very understandable, parsable for physicians or people those who are working on that patient. So that would increase the efficiency and productivity as well. And for that, you see, we even don't have to spend a lot of money. We don't have to be a very knowledgeable about the computers. With a few clicks, as I mentioned here, even with the Excel sheet, or you can use any the softwares that we have available to plot the information that required to shows such kind of functionality. And the third important point is when you store the information electronically, and it helps in like in a way, it's stored in a way which through which you can compare the information. What ultimately it leads to the quality of care and patient safety. That's what this is the important factor which we are looking for, which is an desired kind of point for every facility point of care. How we can improve the patient quality, safety, at the same time how we can reduce the overall spending cost. Uh, um, so that's our few benefits of the EHR. There are several others benefits, but these are considered to be the main. Okay, now a few more points. One is the public expectations. What is that? So the EHR may increase patient satisfaction through faster results, like when you have, your everything is interconnected. Your labs interconnected with the doc office, right? And with the pharmacy, and with the one hospital where you are seeing in Connecticut, with another hospital in Florida. So you see this because of the computer connectivity and internet or intranet, it's a very fast. Messaging patient record portal, you often see, as you visit to the doctor, you get a message. So it's you feel um, the continuously monitored care in that way, comparing to the previous system where you used to go to the doctor's office and doctors they prescribed on a paper, and after that you have to wait for the next appointment. E prescription and the online scheduling, this is very helpful nowadays, especially we have a different, just like ZocDoc and others we have available. with a with your cell phone you can look for the best doctor in your town. You can check for the dates to for the appointment. uh, this is very convenient now. On the federal side, it's considered that EHR to be a transformational, and hence why this for the reimbursement for use. Uh, for several things, federal support this digitization to overall check the community health, to overall monitor, to overall manage the flow of drugs, to overall manage the flow of medical supplies, and uh, so that so based on that, the federal it's very EHR is very favorable to the federal agencies, and that's why we will see, like the next lecture, the federal have a several programs where they support different hospitals, clinics to adopt the electronic health records, and they even pay them for the softwares to buy for the training, for if they use the EHR. All right, now financial saving we discussed partially in previous slides. So with the EHR, as you see, as the things are connected, things are efficient, it takes less time. So less time, less money. You spend a few labor, and at the same time efficiency increase, productivity increase. So it's a win-win situation. And but at the same time, if we see that the the EHRs, why the EHRs are getting acceptance, are getting popularity. The one reason is that the sophisticated tools and easier to use gadgets that we have available. Just consider VR, AR based gadgets, uh, where they almost provide you the or feel you the you feel the environment as you are visiting in person to a doctor. So computers are much faster, and the internet is more prevalent. Wireless mobile technologies are ubiquitous, all supporting EHR. So the hardware and software, if you remember your previous lecture, we discussed about the hardware part, discuss about the software part, discuss about your databases, discuss about the software development lifecycle. So these are all component are supporting directly indirectly to the adoption and prevalence of the EHR. And another important component is the aggregated data. What is the aggregated data? You see that in healthcare setting, when we have to take a decisions, especially the complicated decisions, comparative decisions, we cannot take decisions based on just one health records or 10 or 20. We need several 100,000. Maybe we have to compare one state data to another state data, maybe one hospital data to another hospital's data. So the healthcare data must be electronically to be shared, stored, and analyzed. And if we will not store the data electronically in a way which could be easily comparable, easily shareable, easily plottable, we cannot achieve the actual uh, uh, benefit of the EHR. So research depends on large study population and data set which HR can provide. And if we if we store the data in EHR way, in using the different softwares which are available at this time, we can achieve uh, all the benefits defined over here. Now, as I said here, one of the key component is the aggregation, integration of the data of different types of data. You see, we have the data, uh, we have the data about the EHR, and the EHR we have different types of data, right? The data about from the demographics, like vital signs, to the data about the labs, right? And then we have the genomic data, right? Where we have the data about like DNA level, protein level data. Then we have community data, just like the behavioral data, or we have the data about the facility, for example, the parks near to the household. And sometimes we need to aggregate or link that data up in a way through which we could hypothesize. We can either we can have some hypothesis based on that, or we can derive some hypothesis driven system we can build based on that. So for that, integration is the key. So please, this is very interesting video. I found that you can watch like up to 2 minutes, first 2 minutes, and this will clear you the point in why the integration is very important. Again, when you will watch this video, you can keep your take your notes, and as the video will finish, you can just recall, look at the points that you have mentioned on your paper, and just recall in your mind what story it builds. And after that, you can just write in a 2 or 3 sentences what you got from this video. Okay. All right. So this activity and the previous activity that I have mentioned, these activities at least take your 10 to 15 minutes. Now, look at the components of electronic health records. What are the components of electronic health records? So electronic health record, when we say, actually this is a system, a software which have several components. You can also consider, for example, if someone say electronic health record, it seems like that's the information, it's a record just like in Excel sheet, and it's the information of a patient, like patient ID, name, this like the um, um, information about the labs and all other information. But in general, in the health informatics or in the hospital setting, when we say electronic health records, uh, our main is like the electronic data which is stored the of a patient, but that is and which is stored in a system. So we could actually collectively take the electronic health records along with the software. So what the general perception is, EHR data plus software. So we in combine with, we call it EHR or EHR system. That's why we have different components of the EHR. Let's see what's those components are. Okay, so first component, we will go to these components in details from this class, next class, and upcoming lectures. The first is clinical decision support system, uh, where and the clinical decision support system help to take a decision based on the data. We have the modules of secure messaging. Then we have the modules of the physician order entry, where physician write about the patient. Then we have some practice management modules where they write about, where they add the information about the schedules of the doctor, nurses, paramedics, referral management, automatically keep record of all referral. Then we have the result retrieval. This modules link with all the information from your lab records to your pharmacy records to your health insurance, and can give us the information based on the criteria you select. Then the prior encounter retrieval. This can also keep a record about your the health record, the information about your disease, your previous disease management strategies, your drugs, which you are taking, patient reminder modules. Through this is an automated module. When you see that when you have the doctor appointment a day before or a week before, you will get an email or the SMS reminding you that you have an appointment. And at the same time, this module also sent alerts to the doctors and paramedics, and so that they can prepare before your visit. Then we have the clinical notes, where the clinical notes is a modules where the doctors write about, like in a natural language, about the patient who visit. Multi-input method. Multi-input method is that in medical setups, they not only have just a keyboard, they also have a voice input method. They also keep records now through videos, because of like even you see like in this COVID time, they have to somehow keep a record about your visit, and what they have prescribed, that how you have explained about your symptoms. Access via mobile technology. So they have all these modules are now available through a cell phone as well. Remote access from home, electronic prescription. The doctors write. This modules helps to write the doctors the prescription electronically, which is sent electronically to your pharmacy. Integration with the physician and patient education, public health reporting, quality reports, and problem summary list. And these are actually, at this time, there are more than 75 EHR systems are in the market, and different hospitals are using different system, but the basic functionality are the same. Just like you use Microsoft Word on your Mac or Windows, and they also have the web versions, just like you have the G-Docs. They also have the Microsoft also have their Word online versions, but they all perform similar functionality. For example, you Word in the same way, you can give a formatting in a similar way, and even when you will save the file, you can interchange that file. You can open the whatever Microsoft Word file that you have created in a Mac, in your friend's Windows computer. At the same time, when you upload the file to the Google Doc or on G Drive, you can open your file over there. So which mean they support the formats of each the softwares, though they are more than 75, and it's depend on like the bigger some bigger players, some medium level player over there. It's based on features. Some provide a lot of features, some provide some less feature or very important feature. But the few features that we will discuss in coming slides that are part of every EHR system which are at this time in market. Okay, now continue to the electronic health records component. The electronic health record component, the softwares also have the ability to scan the data. Like sometimes we have something on paper, they are attached to the scanner, and they can scan and save the data with the patient record. Just like you have sometimes the claims data, right? Then ability to graph and track result. It can plot the result for you, for the doctor. Just like you see the activity about your daily with your watch. Similar, they can take if you keep update about your height, weight, and other vital signs, and about your progress. They at the end after a year and or after some time they can show you the your progress as a graph and chart to track. Ability to create a patient list. You can create a group of the people based on their disease, based on their demographics, just to study the behavior or just to study their recovery. And maybe you are giving a one drug to one group, and you are giving another drug to another group, and maybe you are comparing based on some common factors. Ability to create registries. Registries are we will study in detail about the registries. Registries are, you can say, a separate database or separate record where, for example, the registry about the cancer patient, right? Or the registry about you see like a patient with Ebola, registry about the patient with COVID, right? So with that, if we somehow logically create the or create a group, and the motive behind creating that group so that we can monitor their performance uh, as we move on with their treatment. Another point is preventive medicine tracking. Like for example, if the people they are taking their for the immunization tracking, and then how the preventive medicines are working with them, privacy, security, compliance. Like the patient, all as you see that we are keeping record of the patient information. So how the information should be secured, who it should be visible, like a doctor can see that and a patient can see that, not the other people like in the finance people sitting on the front desk or the irrelevant nurse or doctors would be able to see that. So that software allow you to through a very graphical interface like with the check boxes and authorize you to choose the person to who you would like to see your record. Then robust backup system, and it can take automatic backend 24/7. You can store the backend to a place for that's mainly facility for the people, for the hospital people, those who are managing and operating the EHR system. And then the ability to generate a summary of care. Summary of care means like how you are progressing with your treatment. Like you are taking certain medicine dose. Some people, for example, in a cancer, they are on the chemo. So how they are going as their with their treatment, and if they have received the treatment in the previous hospitals, now you can compare with this hospital and when they will discharge from this hospital. So this kind of the timeline of the summary you can build up and care and or generate with the help of EHR systems. All right. So the first components we called special components. As I referred earlier, there are few components which are part of every EHR system, or the essential components of the EHR system, right? So the first module you can say is the computerized physician order entry system, or we call that CPOE in short. Anybody has an idea about CPOE? The people, those who are in a hospital setting, working in doctors' offices, they probably have either worked on this system or at least heard this word before. Okay, so those who don't have any clue, let's see what is CPOE. See, computerized physician order entry. So something a physician is doing with this module, and something about the order entry. But what could be the order in case of the physician? You see, the name itself explains something. You can get, when you read this word twice or thrice, you can get some clue out of that. So CPOE, which is system, is an EHR feature, special component that processes order from medication, lab tests, imaging, consult, and other diagnostic tests. It is not the same as electronic prescription. You see what happens when you go to a doctor. One thing is what the doctor does. Doctor diagnoses you, doctor prescribes you. At the same time, sometimes the doctor asks for additional tests. So, sometimes it sends you to refer to a certain lab. It asks you for certain imaging, for example, going for the X-ray, EMR, or or kind of MRI. Sorry, not EMR. MRI or other images, and also sometimes asked to consult to other doctor, diagnostic test. So everything, these are referred to as orders. So everything which the doctors or physicians, those who are treating you, uh, to communicate with these entities, these are referred to as orders. And it's not same as electronic prescription. Electronic prescription is a separate module. We will discuss about that. Now, the potential or the benefit of CPOE is uh, it reduces the medical errors, uh, but the literature is mixed. So you see, when everything is kind of trackable, when the doctor sends you for an for the labs, for the imaging, when you pick your medicine, uh, when you visit last time, when you will next visit, so you see that it somehow reduces the human error. And but in the literature, in the papers which the people they have studies, that they have very mixed kind of result. For example, they say most early studies came from a select number of academic institutes with the same homegrown EHR and larger IT department. One of the reason is that you see that the results that we have so far are mostly very based on the controlled studies, like from two hospitals, three hospitals, to uh, to say about something uh, very sure, you need a data, large data. Maybe we need data at least 100 hospitals, maybe 1,000 hospitals to say something for sure, and which is not available unfortunately at this time. That's what we say, like uh, the potential to reduce the medical errors for the as well as the CPU is concerned is quite mixed at this time. Okay, now another study suggests that cost saving from a reduced length of stay compared to the paper-based error. Uh, you see, this thing is already attached, also attached with the previous point. You see, when you track your doctor visits, when you track your medicine, when you track your all labs and other procedures, and so there are chances that if the patient get admitted, as it's the patient is taking the medicines and all the procedure properly, so the length of stay in the hospitals may be reduced, comparing to the paper-based records where you don't have anything structured, right? Uh, but still, these are studies. We cannot say the things for sure. Some studies also have shown that improved standardized care with EHR, but it's not universal. They say, like the standardized care, the procedure. You see, when someone uh, goes to the the the, uh, the primary care or to the urgent care, especially in the urgent care, they have steps to work on for every minutes. People come with a trauma. People come with severe accidents, so they have the procedure aligned, like in the first 5 minutes what they have to do that, in the next 10 minutes what they have to do that. So these are that they are referring to a standardized care or procedural protocols. uh, but can we say that like these are universal? Maybe we can say on one facility or in the New York or the hospitals where they have all the facilities, doctors, training available, they maybe get see the benefit out of that, but we cannot claim that the using the CPOE uh, would be that effective, even if it is being deployed in a, like in remote areas in the US and outside of the internationals, like in countries like in Africa, in the Europe and Asia. Now, CPOE is difficult to implement in hospitals because it disrupts workflow and slow physician down. It helps nurses and pharmacists. Though you see this at some point shares the labor, or you can say reduces the burden on the shoulders of nurses and pharmacists, but at the same time training the other staff, especially the the old doctors, uh, and the doctors, those who are uh, very busy in their work. Sometimes they feel that the basic purpose, because of this computer, the patient doctor interaction time, it has reduced significantly. You see, it takes around 45 minutes to 1 hour. You go to the doctor, you check in, you go for your the weight scale and BMI, and when you reach to the doctors, it almost your doctors and physician time, interaction time is around 3 to 5 minutes. It should ideally be more, and but because of this kind of electronic procedures and because of the initial steps that they involve, some doctors and the people like the researcher in healthcare informatics, they feel that it this adding electronic softwares, they have somehow uh, they have stolen the time, the precious time which the doctors can give to their patient. But at the same time, we see this the benefits. So that's why this is CPOE and the use of EHR is quite debatable. Okay, let's see the potential benefits of CPOE as we are seeing. More benefits are like few errors associated with ordering drugs and with similar names, right? If we go with the drugs code, so the errors with the if you write like if you have prescriptions on paper, comparing to this is very efficient, more easily integrated with decision support system than paper. You can easily fed this information to any AI based system very easily linked to a drug interaction warning. So the people often over the age of 50, 60 taking multiple drug polypharmacy. So in that case, it can tell automatically or show an alert to a doctor that the certain patient is taking a medicine which could interact, um, and in that case it can save life. Then more likely to identify the uh, prescribing physician, and you see with that everything is keep record as and so even if the patient somehow forget who prescribed this medicine, especially the patient, old patient, but from their track record, from whatever they are saved in the EHR, you can easily get that information. Then we can say able to link the adverse drug event reporting system. You can even, for example, patient take a medicine, and after uh, using that medicine for a few days, the patient have some, say the patient has some fever, or then they feel some pain in their limbs, so they can go and share that information to the treating nurse, and that information will be saved or put into that system. And you see that when if this electronic system is deployed in one hospital, two hospitals, or see just like a statewide, we can easily get that because of this particular drug. The people, they have this adverse event, and which if you consider the case like 10 like 20 years, 25 years ago, when we did not have such kind of system. So it used to take like years and years to identify any adverse event of a drug for sure. But at this time, though, you can see that the patient, when the patient over 50 years age and from certain ethnicity or with having certain underlying conditions, when they take this medicine, few patients, they have record wrist pain. Then the few say like they have a swelling. So with there, you see that it's very, very easier to monitor and tracking and sharing as well. Then it helps to create a data that is available for analysis, as I gave the example in this case, trackable, can point out treatment and drug of choice. It also says that, for example, for cancer patient, when doctor treating for a cancer patient, it can give the options to choose from, like the chemo or not chemo or the others available medicine, nuclear medicine from that. So and also, for example, when the doctors are going to for a certain medical test, it lists for doctors and the patient as well the available labs nearby, and also their rates for the doctors and the patient to choose from. So this is very, very convenient. So can reduce under and over prescription, cause it keep record. Doctors also see that based on the age, what would be the appropriate value of certain dose, and then a prescription reach to the pharmacy quicker, that we all have experienced. So these are some benefits of CPOE. All right. So I will stop over here and we'll start with the clinical decision support system and the remaining special components in the next lecture. Thank you so much.